with kidney problems and who require dialysis are among patients who will have from January who will take a hit beginning January, that is, as the National Hospital Insurance Fund seeks to operationalize a new scheme under the NHIF Super cover. The fund has issued service provider contracts to healthcare providers, and in which some services millions of Kenyans need have been omitted. Now, this particular number of issue has been objected by the Kenya Medical Association, who we have the representative, the president, in studio. And Helen Aura, first of all, sets a context for this particular issue.
If you were covered under the NHIF Super cover, some changes are coming your way this January. The National Health Insurer is cutting down some funding for some medical procedures and has issued new contracts to health service providers. Dialysis, for instance, has been scaled down to 6,500 shillings per session from 9,500 paid previously. The number of sessions a patient can have also been reduced. A move that stakeholders say will endanger the lives of patients.
Insufficient reimbursement rates will lead to rationing of services, poor quality of services, and an increase of out-of-pocket expenditure, which the UHC coverage plan is meant to address. Poor uptake of NHIF by the informal sector will be worse and will further pose a major risk to the continued financing of essential health services due to high out-of-pocket expenditure.
Through a notice circulation on social media, NHIF has indicated that it will extend the contract signing from the 1st of January to the 31st of January 2022 to allow for the various stakeholders to review the contract. KMA, however, maintains that the extension of time does not address the pertinent issues and is calling for further deliberation.
The contract that the NHIF has sent out to be signed has been rejected, not only by private facilities, but also by public hospitals, because it did not follow the procedure. The NHIF team have contravened the Section 10 of the Constitution, which requires the public participation and involvement of the stakeholders in arriving at management of public fund. And in this case, they've come up with rates that cannot and will ensure that Kenyans do not get the health services that they need.
In the new contract, some reproductive health services, such as the removal of retained placenta and the repair of cervical tears, will no longer be insured to certain scheme members.
This particular contract. Further, the contract as it is only covers 30% of surgical services that we do provide as healthcare providers to the mwananchi. And this will mean that even a mother who's coming to the hospital who wants to receive life-saving breast surgery might not be able to receive this particular service, because what these contracts have done, they have fenced these particular services to particular institutions. These are level 6 institutions.
KMA is now calling NHIF to have talks to deliberate further on this matter to ensure healthcare across the country is accessible to all. Helen Aura, NTV.